We're going to talk about what these are. You might be wondering what they are. We'll look at the details of that and how you might become exposed to something through somebody's blood or other bodily fluid, other potentially infectious material. We'll look at that today. So what are they? What is a bloodborne pathogen, and how does that apply to us in the workplace? A bloodborne pathogen is a microorganism such as viruses or bacteria that are carried in blood and can cause disease in people. And so they're things that we can't see. They're very tiny, they're microscopic, and you might see some blood on a counter or on the floor or see something there, and you might not know what's in it. And sometimes it could have bloodborne pathogens. So we'll talk about what those are today. We'll talk about how they can be harmful to you and your health, and how you can protect yourself from contracting a disease and possibly have poor health conditions from something like this. So that's the goal. As we go through this today, think about where you work. Think about, is there a chance you could become in contact with someone's blood or other bodily fluid? That's the goal from today. So a lot of this training today is about an awareness, being aware of what's out there and the ways to protect yourself as we go through this. So we'll talk about what the hazards are. We'll identify those. We'll talk about prevention, how to keep yourself from coming in contact with dangerous material, the different controls that are out there, some examples of those, and then what to do if you are exposed to somebody else's blood, or if you get that on your skin, how you should go about following up on that and the actions you need to take. That's the goal from today. But we need to realize that blood is dangerous. It may look like anybody else's blood, but like I say, there's diseases out there that we may not know. We don't know what people do or how they live their life or their lifestyle, and you may not know what's there. And so we need to learn to treat it as if it is dangerous and protect ourselves. So we'll look at some ways to do that. But these are invisible hazards. We can't see them. We don't know for sure, and so we just have to always assume that we need to protect ourselves first. There's this other topic of other potential infectious material. There's other types of that. And what those are other bodily fluids from other people. Saliva, it can be in saliva. It can be other fluids with blood in them. Organs, coming in contact with those, or even tissues. If you come in contact with that, you could have a disease transmitted to you. And so we'll look at some examples there. How is it transmitted? How do you get a bloodborne pathogen in your blood or in your body? How does that happen? Sounds kind of gross, but inhalation is one of those. You think about it, if somebody was bleeding or they had some other type of bodily fluid that became airborne, you could breathe that in and inhale it. That's possible. The other is ingestion. You could swallow it. Injection, and this happens a lot. We see claims from this where somebody comes in accidental contact with a used needle, and it gets injected into their skin. And also direct blood contact. If you have an open sore or an open, a cut in your skin of some kind, and you were to contact somebody else's blood, it could get into your blood system that way. So those are the modes of transmission. That's how it can get in, and we need to learn to watch for those and prevent that. But even a small little break in the skin, you could have a bloodborne pathogen enter in if you come in contact with it. Like we talked about, blood-to-blood contact. Maybe you come in contact with the mucous membranes. This is the eye, nose, or mouth. If it gets into your mouth or in your nose, ways like that, it can happen. But even in this time of year, in the wintertime, we get drier skin. You'll notice on your hands, sometimes they get drier this time of year. There can be drying out and cracking, and sometimes your skin will bleed, even on your hands, around your knuckles, and places like that. But any break in the skin, we want to learn to protect and not come in contact with those things. And also injuries with contaminated instruments, such as needles and things like that. So there's a bunch of examples. These are some of the examples we've seen where people have had a possible exposure to a bloodborne pathogen. We had a police officer that was bit on the arm while he was detaining a violent suspect. Again, you don't know what that suspect has done. You don't know what their health conditions are like. You don't know if they could have some kind of a disease, but by biting, that it's breaking your skin, possibly contact with their saliva or maybe even some blood, you could get a bloodborne pathogen that way. Another case we had, throwing a toilet away into a dumpster. It was a used toilet. It was an old one they were changing out, and they threw it into the dumpster at the shop, and it cut their finger. Again, it sounds kind of gross, but you don't know what's on that toilet or who's been using that toilet. And again, if it penetrates your skin or gets injected somehow, there's a possible exposure. And a third example, and this happens as well sometimes, is while disposing of needles, an employee was punctured by the needles that did not have the caps on them. So there's a perfect example of an injection of some kind. But again, we want to look for these things. We want to protect ourselves. We want to make sure that we're not leaving needles out that aren't capped, or that we're using the right equipment to prevent these kind of things, the right protective equipment as well. So we'll look at some more examples there, how to protect yourself from those, but those are just some things that we've seen happen before. So what kind of bloodborne pathogens are out there? There's a whole bunch of them. I'm sure all of you have heard of HIV and AIDS. Back in the 80s, this was a big scare. It was spreading. People were really concerned about it and getting really sick from it. And back then, they were worried that even shaking somebody's hand, you could contract HIV or AIDS. They've now learned that that's not the case. There has to be some kind of blood-to-blood contact, or getting into your body from one of those transmission ways that we looked at earlier. So HIV and AIDS is one of them. It's a big one. Hepatitis B is another one that's common that we hear about, and also hepatitis C. And there's many others that can be carried in our blood and in our bodies. Malaria is an example of that. Syphilis is another example. There's several kinds out there. But again, we just don't know, and we need to protect ourselves. So looking at HIV, what is that? It stands for human immunodeficiency virus. And what it is it attacks the immune system. So when you get that in your body, it weakens your immune system. It makes you sick, so that when you do get sick, you have a harder time healing from that or overcoming even small sicknesses. The thing about HIV is it's very fragile, and what that means is that it only survives a few hours in a dry environment. So if somebody bleeds and they have HIV, and let's say it gets onto a surface in the workplace, if it's out in open air, in dry air, only a few hours, it won't be infectious. After a while, it won't last for very long. Usually it's that blood-to-blood contact where this becomes really infectious to you. But it could be out there. You don't want to take any chances. You still want to protect yourself because you just don't know. The thing about HIV is there's really no cure, and there's no vaccine available yet. So we got to protect ourselves with that one. Hepatitis B is another one. Now, a little bit different than HIV. This one is very hardy. This one can live for 7 or more days in dried blood and be infectious after that time, even up to 2 weeks, I've heard, on hepatitis B. So, for example, let's say somebody cuts their hand and they're bleeding, and they go and they touch a door handle to go through a door. If that blood is on that door, it can still be infectious to you. And so if you had a cut or a tear or some kind of sore on your hand, and you come and you touch that door handle, you could still get in contact with that and contract that bloodborne pathogen into your body. So hepatitis B is very hardy. It lives for a long time, 100 times more contagious than HIV. There is no cure for hepatitis B, but the good news is there is a preventative vaccine for that one. And a lot of workers do get the hepatitis B vaccine. Children in schools get their hepatitis shots, and so there's kids getting that. But as adults, we want to make sure that we are definitely covered on that and get the vaccine. That is the recommendation there. Hepatitis C, this is another very common, actually it's the most common bloodborne pathogen infection in the United States. It is the leading cause of liver transplant. And what it does is it attacks the liver, and it makes you feel really sick. It's flu-like symptoms with fatigue and nausea over a long period of time. And that's something we don't want to have. But people get this. It's very common. I know somebody in my own family that has contracted this at one time. They don't know from where or how, but it's something that can be out there. And if you come in contact with blood or infectious material from somebody else, you could possibly contract this. So we want to look for those things. Those are just some of the main ones that we see that are the most common out there. But think about your occupation and where you work. There are some occupations that have a higher risk of being in contact with blood or bodily fluids from other people. And those occupations, if there's a reasonable expectation of that, you're going to want to make sure that these people have the training and the things that they need, all the equipment and everything to protect themselves. So medical personnel, obviously they're working around with people, possibly blood, possibly using needles and things like that, where there could be an injection of some kind or contact with blood. Janitorial staff are another. They're the ones that are doing the cleanings. They might be around hazardous waste, that could be infectious waste, that could be in garbage cans. They could be cleaning restrooms or floors where blood may have spilled on or body fluids could spill on. And so they are definitely a higher risk of being in contact with those things. Fire and EMS working with the public, same with law enforcement as they're working with suspects and dealing with the public, especially up close and sometimes, physically having to take them down. There could be cases where they come in contact with those things. And even those that work around sewer, the people that work around sewer, it's highly recommended that they get their hepatitis B vaccinations because, again, you don't know what's in that sewer, and you definitely want to protect yourself. So those are some of the occupations, but think about where you work. Do you need any extra equipment? Do you need any plan in place? We'll talk about those now for the places where you work. So one of the things they recommend with bloodborne pathogens, the best way to protect yourself is called universal precautions. And what that means is that you treat all blood or all other potentially infectious material, you treat it as if it is infected. And you don't assume, just because you know somebody or maybe they're your friend or whatever, you don't assume that their blood's okay to touch. And so if they're bleeding, you don't want to, just go touch their blood. You want to make sure that you're protecting yourself with gloves or the right equipment or, having procedures in place to protect yourself from that. And I think of often the first aid and CPR responders. When you go to respond to something like that, think about the risk. Think about making sure you put the gloves on and use the things that you need to protect yourself, because you just don't know. You just don't know what's out there if somebody is carrying a disease of some type that you could get. And so that's number one. Rule number one is protect yourself with universal precautions. So OSHA has recommendations on this. There's things that they require from their employers. All employers should have things in place to protect the employees from bloodborne pathogen exposures. And part of that is doing an exposure assessment, looking at the workplace and finding out what kind of exposures could there be and what do we need to do as an organization to protect our employees. And so that's number one. They also require training. That's why we're doing this webinar today. It is an annual requirement to do bloodborne pathogen training for employees that can be reasonably anticipated to be around bloodborne pathogens or around blood or bodily fluids. So that's part of it. Each organization should have an exposure control plan, and we'll look at an example of that to put these things in place and the practices in place to make sure that employees are protected. Engineering and workplace controls, we'll look at examples there. This is to prevent contact, vaccinations, providing that as needed. Post-exposure evaluation and follow-up, this is after somebody gets exposed to blood or body fluids, and record keeping as well. So those are all some of the requirements of the OSHA standard. When it comes to training, we cover the things that we're covering in this webinar today, but employees need to know what kind of symptoms and epidemiology is out there, what kind of diseases are out there that they could get, the regulations from OSHA that we've talked about, modes of transmission, employer's plan. So if you have a plan in place, the employees need to be trained on that to know how to do the practices and procedures in the workplace to protect themselves, and then training on how to use the PPE, how to put it on properly, how to dispose of it, all the things that they would need to know to protect themselves. That's the requirement for the training. One of the keys is be prepared for it. So anticipate exposures. Think about your occupation, where your employees work, in what ways could they become exposed to that, and make sure that you have the equipment on hand readily available and personnel trained and prepared to deal with situations like that. If they had to respond to providing first aid of some kind, would they know how to do that? Would they have that training to do that? That's part of being prepared for it. As we talked about with vaccinations, hepatitis B is one of those. We do recommend that if you're reasonably anticipated to be around those things, but you can also decline it. There are some people that don't want to have vaccinations, and they have a right not to have them, although it is the recommendation. And so if they do want to decline, there's a form out there that you can use to have your employees sign off that they're declining the hepatitis B vaccination. And so you can see this is an example of that, and you can find this online, and we can also share these resources with you. But you can put this form in place, and the employee can sign off, and you can keep that in their personnel files to show that you did offer the vaccination, but yet they declined it. One thing about this declination is they can always change their mind. They can decline it at first, and they can come back and say, you know what, I do want to get that vaccination now. And that form spells out there that they have had that choice, they have been given that opportunity, they declined, but they can also come and get it again later. But that form protects you as an employer, showing that you have done your part to provide that vaccination to them. So the exposure control plan. You can find many templates for this, but the OSHA website has one. If you go to osha.gov and type in bloodborne pathogens, you'll find a link that goes to their exposure control plan template. And this is a very simple way to put one in place. It guides you through. You can insert your information and set it up the way that you need it for your organization. But in that plan, there's a few things that have to be in there. You want to have your determination of your exposures, looking at it, doing an assessment on it, finding out where the exposures could be, identifying the controls that you'll use and how to protect employees, the different equipment that could be out there, things like that. The training, the hazard communication that goes on with it, talking about the vaccine like we just did, and what to do if there is somebody exposed and what record keeping needs to be kept. That control plan can all have that information for your employees to review and learn from. So again, you can find that template there, and we can help provide access to that if you need to find that as well. But exposure controls, the number one thing, the best way to prevent becoming in contact with that is simply universal precautions. It's simply not putting yourself at risk. It's keeping your hands washed. Believe it or not, just simple water and a little bit of soap, and washing if you become in contact with something is the best way to protect getting something into you. So universal precautions, assuming that all blood and other materials are infectious. If you assume that and you treat it that way, you protect yourself. You're likely to not contract one of those diseases that way. So having the right equipment, having good work practices, having the right personal protective equipment, maintaining good housekeeping in the workplace, not letting blood or body fluids sit around. You clean it up promptly. You use good cleanup. Proper disposal of things is another key to that, and also labeling things can all help to prevent exposures to bloodborne pathogens. So there's two kinds of controls out there, things that you can do. One is an engineering control, and another is a workplace control. So as far as the engineering controls go, these are devices and equipment and things that make it a lot easier to avoid becoming in contact with those things. So an example here is a sharps container. You can see on the left, medical personnel will use these when they have a needle that they use when they're giving an injection of some kind. They will take the sharps, the needles, and they'll put them in these containers where it's closed up and sealed and protected. It's clearly labeled, so people know what it is. It's got the biohazard sign on it. Those are really good engineering control and something you can have in the workplace. Other examples are for those that draw blood. When you go to get a blood test done, they'll prick your finger. So the one on the left, when they prick your finger, the blood stays on the outside, and anybody can come along and possibly come in contact with that. Whereas the ones on the right are a little needle that retracts. So it pokes and it retracts back into place, and it's engineered in a way that it's not left open to get accidentally poked by it after it's been used. And so those are just some ideas of engineering controls out there. This is another one. The one on the left is what police officers can use for removing the parts of a taser. After it's penetrated somebody, you can remove that with that tool, and it covers it, it caps it, it keeps it covered so people don't come in contact after that. Same with needles. When it comes to needles, there should always be caps back on the needles, but there's also requirements that if there are better engineered controls out there, we need to be using those. So there are some needles that you can do your injection, hypodermic needle, you can do the injection, and then it will retract that needle automatically. You won't have to put a cap on. You won't have to take that and poke yourself. And the other thought of that is, think about best practice of how to put that cap back on. If you did have the kind that need a cap put on there, don't use your other hand. Don't put your hand in harm's way. Don't position that needle in a way that it accidentally pokes into your hand as you're trying to put that cap on it. Maybe there's a tool that you can use. Maybe there's a way to put it down and you only have to use the one hand and not put your other hand in the way of getting poked by that needle. Those are things that you can do. So think about workplace controls. Are there good processes to help each other? Are there proper ways to put things on and off, like protective equipment? Putting those things in place can make a big difference for preventing the contact there. When it comes to personal protective equipment, buy the right stuff. Know what kind of gloves you need to have, what kind of face shields, any aprons or anything that you might need. Make sure you have the right stuff for the type of work that you do and for those potential exposures. Have it available. Have it readily available and quick to get to. make sure that employees are using it. If you don't use it, you're not protecting yourself. You're not using universal precautions if you're not using the right equipment. Proper donning and doffing, that really means how to put it on and take it off. There's a certain way to do that, and you can get trained on that. Even taking off gloves the right way, there's a certain way to do that where your hands don't get contaminated from what could be on the outside of your gloves. And then proper disposal as well, making sure they're closed up and put in the right places, disposed of properly. Those are things to prevent that. When it comes to cleanup, make sure that you do that. Part of that is being diligent about it. If you see some kind of fluid on the floor and you don't know what it's from or who it's from, again, you use the right equipment, get it cleaned up, and get it taken care of and out of there. Use the disinfectants and good materials to clean up there. As far as disposal goes, they have these red bags for biohazard infectious waste. They'll take their sharps and put in there, but again, if you're going to dispose of those, make sure those sharps are capped and put in the right way or in the containers that they need. There's been times where people have been poked through the bag, where a needle is sticking out and it comes through the bag and accidentally hits somebody. So proper disposal and good labels, good disposal is key there. If you do feel like you've been exposed sometime, maybe you had to provide first aid to somebody that was bleeding and you possibly came in contact with blood, or you feel like maybe there's some other body fluid that got maybe ingested or somehow onto your skin. If you feel like there's something there, the best thing that you can do is do a quick cleanup. So immediate first aid is good, but the best thing is get some water on it. Get some good water, clean it off, use some soap, and flush that area off of your skin or off of your hands if you did happen to get blood on there. The best thing is quickly get that off of you and clean up thoroughly. And then second, you want to notify somebody. Notify your supervisor, and they will notify if a claim needs to be submitted or if there's information that needs to be passed on, they will take care of that. But definitely tell somebody. And if there's a significant exposure, such as maybe you accidentally get somebody's blood into your mouth or directly into into your body somehow, if you feel like there's been something significant, you're definitely going to want to get some medical follow-up because you don't know what could be there. And so part of that is knowing what to do and who to contact. And a lot of this is about awareness today, just being aware of what's out there and how to protect ourselves. When it comes to record keeping, this is for the employer. If there is an employee that's exposed to a bloodborne pathogen or possibly exposed, this information needs to remain confidential. This should be in their personnel files and shouldn't be out there for everybody to know about or hear about. But if they are exposed, there's a requirement that OSHA has for record keeping where you maintain documentation of that for 30 years after the termination of their employment. So again, that's a long time, and that's right, it is 30 years to keep that paperwork for a long time after. But that's the requirement there. So to summarize, it's a lot of information, and there's a lot to it, but the key is we have to accept that we could be in contact with somebody's blood or other potentially infectious material. You just never know. You never know when somebody could be bleeding. I gave the example of the door handle. You never know when there could be something on the door handle, and so we have to protect ourselves. We have to realize that we could become in contact with that. So universal precautions is number one, keeping your hands washed and clean, covering up if you have a cut or a sore, keeping a Band-Aid on it, covering those things up really helps to prevent exposure to those kind of things. The key is protect yourself. It's your life, it's your health, and being aware of that and protecting yourself is number one. Prepare for it. Your organization can prepare for it as you train each other, as you get your exposure control plans in place. You can prepare for that and make sure you have the right equipment and the right engineering controls and workplace controls to prevent that. So evaluate your programs. Think about what you do there at your organization. Think about if you need more employee training or getting the right things in place. It's really up to us to be aware of it and make it happen. That's really the goal from today is an awareness on how to protect ourselves there. Jason, any questions out there that you see from today?
I haven't got any questions in yet, folks. If you've got a question or a comment for us, type it into the chat box or the Q&A box, and we'll go from there. I don't see any coming in. Brent did an awesome job talking about this subject. One thing, just a thought as you were going through that, we talked about proper procedures for doffing PPE. You think about that, just those little exam gloves, nitrile gloves, and you don't think much about about those, but the simple act of taking those off in the appropriate manner can have really big effects. When we had Ebola patients come to the United States, there was one case of Ebola transmitted here in the U.S., and the reason, after they went through all their research, it was improperly doffing gloves. Instead of pinching on the outside, like you saw in there, this nurse actually stuck her soiled finger in underneath the glove and came in contact with her skin, and she got Ebola from that. So it just highlights those things. Let's see. We have one question. Do you need a sharps container for parks facilities? Well, that's a really good point. Doug or Brent, do you have a thought on locations for sharps containers?
As far as location, I'm not really sure because a lot of the Parks Department employees are probably mobile. But obviously they could find a needle out there in a playground or something like that, and it'd be good, maybe in the truck. Maybe in the truck they could have a container to keep those in.
As Brent talked about the exposure assessment, I think that's really what we've got to look at is where might we see these things. You talk about parks facilities. Would it be a good idea to have a sharps container in a restroom at your parks? Well, we look at that and say what can happen there. People are using your parks that maybe need to inject insulin. Sometimes we have people there that are injecting drugs. As much as we wouldn't like that happening in our park facilities, I would a lot rather people putting those sharps into a container, providing that as part of our facilities, than have those being discarded out where somebody could come in contact with them. Sometimes the physical location of the container can have a big impact. We had one of our fire departments that had a lot of sharps related injuries, bloodborne pathogen exposures, and they did a simple thing by adding an additional, I think they added an additional sharps container and put it on the opposite side of the ambulance, so they didn't have to stand up or reach to put a sharps in the container. And their sharps related or bloodborne pathogen related injuries went way down, almost eliminated those just by simply putting them in a little bit different location or putting an additional one in there. So I think that's a great thing for all of us to look at is where should we have these things? The restrooms generally are a great place to throw a sharps container. Let's see. Another question here, is there a program to download for teaching? Really what we do is we record these webinars and place those up on our website. So you can go to utahtrust.gov/webinars, and this program will be placed up there as soon as IT gets it posted up. We send it over to them, and then sometimes it takes a day or two before it gets up there, just depending on how much stuff they've got going on in their world. But that's available. There's also, Brent, there's a lot of material on the OSHA side as well, correct?
Yeah, there is a lot of resources there. Go to OSHA.gov and search for bloodborne pathogens. You'll find a lot of templates and things there.
Yeah, and you can also hit the A to Z index on the OSHA page. I found that's easier to navigate than searching sometimes because you get a lot more focused stuff there. So. Okay, looks like that's all of the questions that we have. Brent, final word?
That's it. Everybody be safe. Have a great day.
All right. Remember, folks, that we have Doug coming up here in just less than a half hour. We're going to be talking about the Trust Accountability Program. If you haven't signed up, send me an email right now, jason@utahtrust.gov, and I'll get you a hot link for that so you can get right into the presentation. Also, remember on that note that the Trust Accountability Program deadline for 2018 is next week, January 15th. Is that a week from tomorrow, I think? Anyway, so we're coming down right to the end. So if you haven't turned in your application for getting your money back and your discounting, make sure you get those taken care of right now. If you have any questions about that, need some help getting through those requirements, talk to us. Give us a call, and we'd be happy to help you out. All right, good job, Brent. Thanks so much. We're going to wrap this up. Everybody have a safe day out there. And we'll see you in just a few minutes for TAP 2019.